15 cases are from New South Wales.
And we've just got some breaking news to hand from Victoria Health. 3 COVID deaths now. The national toll has risen to 12. This is breaking news now, and all 3 Victorians were in their 70s. Another death in Victoria. Let's take you live now to Victorian Health.
Effectively one small pack of their regular medications. They'll have a relationship with their pharmacists, of course. They'll have a history there of their prescription medications that they usually get, and they'll be able to get those Schedule 4 medications from their pharmacist without needing to go to a GP in the first instance. So this is just designed to make it a little bit easier for people to be able to fill those scripts whilst they are self-isolating, and of course because we also recognise that our GPs are going to be increasingly busy in coming weeks as they see more and more individuals who will be coming in to see them potentially for COVID-19 as well. So I'll leave it there, and we're happy now to take your questions.
I don't know if you're the best person to talk about this, but yesterday there were obviously only 2 people in ICU. Neither of them were men in their 70s, so I'm guessing the deterioration for these 3 people was quite rapid.
Yes, I'll ask Brett perhaps if he wants to address that.
Not every patient is necessarily appropriate for intensive care or chooses to have intensive care interventions. So those who are in intensive care at the moment are obviously appropriate for intensive care. But yes, if there's a rapid deterioration, then sometimes the choice is made on the ward to manage those individuals. I think the issue is that the vulnerability is being over 70 years of age. Anyone who's got another pre-existing condition is at another level of risk. But I certainly don't want to give the impression that if you're over 70 with no medical conditions at all, that you're not at risk of dying or of needing intensive care, because that's certainly the case. The older that you get, especially over 60, 65 years of age, the greater the risk of severe illness. These men did, yes, but as I say, you can be over 70 with no pre-existing conditions and still be absolutely at risk.
The press release we've just received says there are 3 people in intensive care. Does that remain the case, or does the person who just died, were they in that?
No, my understanding is that there are 3 in intensive care as of today.
What's your take on the increased number of cases being 54? It's slightly down on the last few days. Does that suggest we're getting a handle on it, or is it just...
I think I said yesterday it's not a time for complacency about numbers. If there's stabilisation, I would absolutely welcome it. It might be a reflection of decreased returnees from international travel, but we know that there are a number of other international travellers who won't have been detected, who haven't necessarily complied absolutely with isolation or quarantine. And so we have to be mindful of the fact that there might be a flattening this week, and next week we can see a significant increase in numbers. So I welcome a flattening of numbers if it's sustained, but I certainly don't expect that it will be so. I think there are cases out there who have deferred the time to test, who can put others at risk, and those close contacts can then develop illness. So we have to keep a very close eye on how this is going.
Is now the time to act to go to stage 3? Yesterday you tweeted go hard, go fast. Is your recommendation to the government to go to stage 3 now?
I've provided my advice to State Cabinet, to the Premier. The Premier will take that case to National Cabinet, and they'll make a call. I think if any of us fail as the elderly, as youth, in one suburb or another, in regional Victoria or Metro Melbourne, then we all fail. So I think it's important that we all do what we can across the country to make sure that we can keep this under wraps.
What are your thoughts on how well people are? Is it time to do that now? Is now the time?
Look, I think it's a matter for National Cabinet. There are lots of opinions, there are various inputs, and there's new data that's coming through every day. So it's not just my opinion. I've provided it, as I say, with frank and fearless advice, but there are a whole lot of inputs that need to be considered, and National Cabinet will do so. Grant?
Do you feel that Victorians are obeying it well enough to your satisfaction?
Not to my satisfaction. I think a lot of Victorians are doing the right thing, but as I say, if there's a group of people or a cohort in an age group or in an area of Victoria who are not following, the very strict recommendations we're saying about staying at home, otherwise lives will be lost, if they fail and it escapes in an area or in an age group, then we all fail. So we need absolutely everyone to be on board here.
Presumably you're getting sick of telling people that.
I will never get sick of telling people it. It is a critical message. I'm happy to bang the drum on just how important it is at a family level, at a community level, wherever you are in workplaces or elsewhere. This is the most important thing to get across, that if you don't have to be outside your home, then stay at home. And you know, the positive here is that we can make a difference, that we can actually not go down the pathway that many countries in Europe and the US are heading down, a catastrophic pathway. We can actually go down a different fate for ourselves, and we should.
Brett, can you give us a sense of what stage 3 will look like when it comes?
No, I can't. I think, you know, we've seen that other jurisdictions internationally have taken more extreme measures. All of those options are available. We've not written anything off in terms of what might be applied, but I'm not going to speculate on what those decisions might be.
Just with the testing, how long does it take? Maybe not, but how long does it take? Is there a lag? You say there's 520 confirmed cases now. Is that testing from, say, Tuesday? Is it people who tested yesterday, just in terms of...
I think the vast majority of tests are coming through within 24 hours. We've got over 3,000 tests that can be done each day, so there's a big capacity there now. The lags that I'm concerned about, the delays, are in people who are unwell and who don't test until 3 days later, or who don't test until a week later. That's still happening, and maybe because it's people who have mild illness. But if you're in quarantine and you've been flagged as greater risk, because those are the individuals who are at greater risk, then don't delay. If you've got symptoms, get tested, because you'll get a confirmed result and you'll be isolated and your close contacts will be followed up. So they're really important messages, that people shouldn't delay the time from developing symptoms and getting tested.
Are your tracing activities starting to show some pretty clear kind of family trees where one infection relates to another, and there is irresponsible behaviour that is having an impact?
We're certainly following up all the close contacts of our cases. They are overwhelmingly doing the right thing because they've been flagged as close contacts. But for those who've travelled internationally, I think they don't identify quite the same way, that they're at a significant risk. But, you know, 50% of people in the US who are being tested now are turning up positive. So if you've come from the United States, if you've come from Europe, where there are hotspots or not known, you're probably at significant risk. So you really need to be considered as someone who's been a close contact of a confirmed case, because your risk of developing illness is not insubstantial. And so being out and about is absolutely the wrong thing to do. So I want that to be clear for everyone. But for those who are told to be in quarantine, that's a red flag. That is a stay away, because you could develop illness and you could transmit to others if you're not at home.
But amongst those clusters, are you finding that...
Sorry, which?
These 3 deaths, which hospitals were
I'm not naming the hospitals, but they were in Metro Melbourne.
With these clusters, are you finding that when one person's infecting, are you finding that are you finding a dozen people hooked up to one person, or is it one person here and there?
No, it's one person here and there, and there's a chain sometimes when people haven't isolated immediately. But we've also seen clusters that have occurred in those settings that we're now really shutting down. So the weddings and the restaurants have caused clusters of cases, and also dozens of people exposed who now need to be in quarantine. So they're important lessons about everyone being at home and keeping that distance from others.